Hello everyone, I hope you are preparing well for your exam. Everything is fine with you. Today we have a specific type of letter, of referral letters, which is the urgent letter. It's as usual as we are preparing for any referral letters. However, the order to write the visits, it will be different than the normal referral letter. I mean that we are talking about the most recent problem, the complaint which trigger you to refer the patient urgently to the specialist. So, if the recent problem happened on last two visits, we will start talking about the last two visits. If that was only the today's visit, which has this recent problem, so we will talk about the today's visit. I mean that we need to talk first about the most recent problems, either it was in one visit or two visits. And then after that, after we finish the target, the intro, and the most recent problem, we can go back to the past history, previous visits, social, and then we write about the task at the end. So this will be the type, how to write it, regarding the urgent letter, the manner of how to write it. Okay, let's see. We have a patient called Ammar Mustafa. Date of birth is 15th of January 69. We will write it complete date of birth. Social, he is divorced and lives alone. He is a smoker, drinks 14 units per week. It doesn't matter how much it is. For your information, it is the normal amount recommended by the NHS, 14 units per week. He has past history of typhoid fever and he was hospitalized for 6 days. And then we will go for the 2 days before visit, which was on 18th of October 2017. When Ammar feels unwell, he has lack of appetite, sense of weakness, lack of energy for the past 3 days. He has reduced smoking to 5 cigarettes, not drinking for 1 week. Patient looks tired, jaundiced. Cardiovascular respiratory examination were normal. However, abdominal examination revealed lax and mobile, no mass or rebound tenderness. The only positive finding is he has tender hypochondria without organomegaly. This is triggering or the provisional diagnosis of prodromal stage of liver disease. He was advised on low fat, low protein, rich in carbohydrate diet, and we ordered for him blood, urine, and stool test. Now, and he was prescribed vitamin B complex. On today's visit, which will be 20th of October, Ammar is getting worse. He cannot tolerate food. Noticed that urine is getting darker in color with chills and rigors. Temperature is high, jaundiced, dehydrated. There was palpable tender liver without ascites, deranged liver enzymes. The plan to start on IV fluids, Rosfen and Flagyl. And we contact the flying doctor service for urgent ultrasound examination and the task to evacuate the abscess, as the ultrasound showed enlarged liver cystic lesion in his right lobe of liver. Now we are arranging urgent referral to the surgeon by the flying doctor service, escorted by a registered nurse. For urgent assessment required, including ultrasound guided drainage, which is the task. Okay, let's go. So we will copy paste as usual. We will copy paste the address, surgical registrar to whom we are sending the letter to, emergency department, the name of the hospital, copy paste, address, first line of address, London, postcode. Then we will leave an empty line, go to the 2 days visit date, which is 20/10/2017. Then leave an empty line, dear doctor, comma. Then empty line regarding RE, colon, Mr. Ammar Mustafa, which is the full name. Then leave space on the same line, date of birth, complete 15/01/1961. Okay, then we'll go to the intro. I'm writing to urgently refer Mr. Surname Mustafa, comma, a 56-year-old process technician at a copper mine, comma, whose clinical features are consistent with a liver abscess. Why consistent with? Because we have already diagnosed it with an ultrasound, shows that he has liver abscess. Your further assessment and expert management would be highly valued, highly appreciated, whatever. Okay, so this is the intro. We can, in this specific letter, because there was no past history except from the typhoid fever, it was long time before, it doesn't matter. It's not of value for the recent problem. So either we can start with the today's visit, then proceed to the 2 days before visit, or we can start it chronological 2 days before, then today's visit. Whatever, both of them are correct because the only problem have occurred in the previous 2 days. So either of this manner will be correct. Okay. Today, Ammar is getting worse, can't tolerate food, urine is getting darker, so how we will write it? On today's review, because he came 2 days before, so today's is his review. Okay, comma, Mr. Mustafa attended with complaints first mentioned, so it will be without the, with complaints of inability to tolerate foods and altered urine color, comma, along with chills and rigors. So we will mention the four finding in the same line, connecting with, along with. Okay. On examination, comma, he was febrile or feverish. He was febrile at 39, comma, jaundiced and dehydrated. Because we mentioned we have connected with along with in the previous line. Now we will write it normally simply, comma, and. Okay. In addition, comma, his liver was palpable and tender. Okay. Previously requested laboratory blood test showed uropilinogen in his urine and leukocytosis. Because we have mentioned before, along with, we will now change it into as well as. Connect with, as well as, elevated serum bilirubin and deranged liver functions. Okay. Therefore, intravenous fluids and Rosphin, in addition to Flagyl, were given. The Flying Doctor's Service. Now you will mention the Flying Doctor's Service and its 3 words more than one time, so you are totally free to write it first time, complete, and between brackets the abbreviation, and then when we can repeat or mention it again, you will we will mention it with only with the abbreviation. Okay, as long as you have mentioned the abbreviation the first time between brackets. So the Flying Doctor's Service was contact for an urgent ultrasound assessment, which showed enlarged liver with a 10 by 10 centimeter cystic lesion in his right lobe. So that's happened today's visit. How to write in the notes, in above notes, and then how we can write it in a paragraph grammatically correct. Okay. Then we can proceed to the previous visit, which was 2 days back. Ammar feels unwell, lack of appetite, sense of weakness, lack of energy for 3 days. So how we will write it? We've mentioned new paragraph. We will start with Mr. Mustafa Surname again. Initially presented 2 days ago with a 3-day history of anorexia, lack of appetite, we will write it anorexia, and tiredness. Adjustment of his lifestyle was reported because he reduced his smoking, not drinking, so adjustment of his lifestyle was reported. His assessment was unremarkable apart from tenderness in his right hypochondria with no organomegaly. So we have mentioned it, his assessment was unremarkable because cardiovascular, respiratory, abdominal even was normal, apart from tenderness in his right hypochondrium with no or without organomegaly. Okay. Consequently, the necessary blood laboratory tests were ordered, and vitamin B complex as well as essential food were prescribed. Okay, so we are collecting too many information in one sentence. He was advised to increase carbohydrates intake. Please notice that he is a smoker and drink alcohol, or he is a smoker and a drinker. So because he is a smoker and a drinker, it will be more better. Okay, so we are adding these two nouns to each other. Okay. Then we will go back to the aim of the letter again. Mr. Mustafa will be escorted by the Flying Doctor Service, written in abbreviation, under nurse supervision for ultrasound guided drainage if appropriate. If appropriate, would be like a more polite, like if according to what you see. Please do not hesitate to contact me should you need any further information without S. Then you will leave two empty lines, your faithfully, then the name of the sender, the doctor. Okay, so we will go back. So this is the full letter again. I start with the address, the full address, copy paste from the letter, today's date, full date, dear doctor, regarding the patient full name, date of birth, the intro, and on today's review. The 2 days before visit, then the social and the aim of the letter, yours faithfully, Dr. Peter Smith. I hope it is beneficial to you. I hope that the today's video is helpful. Whenever you want to write a new letter, please send the medical notes in the comments, and I will upload a video writing this letter in the next few days. I'm very happy to help you. Thank you, and have a nice day.